Hi, this is Dr. Wells again, and I'm here with another question that I get asked frequently, which is, what does ketamine feel like? I think this question is a very common question because most patients don't have experience with this sort of journey during regular everyday life. This isn't a feeling that you're going to get from Diet Coke or from too much sugar or even from alcohol, which are more common substances that people use. In general, ketamine infusions feel very floaty and peaceful. So most patients say that it's a very enjoyable experience. Ketamine journeys are very individual, and people bring with them things from their everyday life. So a ketamine journey for a patient on Monday can even be different than their ketamine journey on Tuesday, and it can be affected by the medications they're taking, how much sleep they got the night before, whether or not they had a spicy burrito before, they went to bed the night before. Sometimes it depends on coffee if they've had some that morning, or ADHD medications, or whether or not they took their medications that morning. And a lot of ketamine infusions effects are based on dose. So if you change the dose, even on a patient who's had ketamine before, their experience of the infusion can be very different. Around 85% of patients find it to be pleasant or calming. Another 10% find it to be very neutral, and maybe 5% find it to be very disconcerting or unsettling. We try very hard to minimize that 5% as much as possible. We try to encourage patients to bring music that they enjoy, to set up the room with a blanket or a weighted blanket and lights the way they want, to encourage the best possible experience for them. Usually it helps if they haven't gotten into a fight on the way there, or their Uber driver hasn't gotten into an accident. But even then, some peaceful breathing, some relaxation music, and generally it's a pretty nice journey.